All right. Hello, everyone. Thank you for being here. Welcome to the special meeting of the Continuum of Care for Seattle-King County. Today is Friday, August 21st, 2026. It is 2 o'clock and I'll call the meeting to order. Catherine, can you please do the roll call?
I will. Tamara Bauman.
Here.
Amaya Lenore.
Here, thanks.
Elizabeth Mopin.
Here.
Ruby Tuesday Romero.
Here.
Christina Sawicki. See her. Christina, can you hear us?
Here.
Thank you. Victor Liu.
Here.
Amy Thomas. Valerie Sasson. Rocco DeVito. Jen Carl. John Urquhart. Mercy Wainana.
Here.
Jack Harlan.
Here.
Michael Pickett.
Yes.
Patrick Arney.
Present.
Tina Brown.
Here.
Nicole Alexander. Devin Koenigsee.
Here. Oh, Nicole Alexander's here.
Oh, thank you, Nicole. And Devin Koenigsee.
Yeah.
Thank you.
Okay, great.
Ruby, you have 13 members present.
That's quorum. I see a note in the chat about a link. I just want to make sure that everybody can access it today.
Yeah, and Kelsey was over in the teams bringing people over to the meeting, so.
Oh, I think we're talking about the Zoom link from the actual website.
What's wrong? It's.
I'm trying to see if it's going through, and I don't know if it is. So please, somebody, if they could test it as well before we proceed.
Would you mind going on our website? We did triple check it.
I think I just saw Kelsey triple checked.
Yeah.
The only, yeah.
Yeah, double and
we're-
triple
I think
check
we're-
the
I think we're
online.
good.
When I select it, it goes to not, it is a broken link. So I just want to make sure that we're able to be running a meeting right now. That's all. It could just be my internet. It could just be my internet.
Is there anyone coming on who's not part of the board for public comment using that link?
This is Christina. I always use the links on the website, and I came in
Okay.
through the website just fine this time.
Awesome. Thank you, Christina, for that clarification.
Thank you.
Yeah, that's great to hear. And sorry about that delay. I just wanted to make sure. Before we get started with the land acknowledgement and the theory of change, I just wanted to remind our board members and also let our new board members know that we do have a captioner that is present during our meetings. And so when we speak, it's best to speak slowly. And if we could state our name before speaking, that will really greatly help the captioner and those who need the assistance there. Thank you for that. And then also on the agenda, it says that we would be calling the System Performance Committee to order. And I just wanted to make sure that, or maybe that was an old one, but regardless, this is the Continuum of Care meeting. And I just wanted to hand it over to Elizabeth to do the land acknowledgement.
Land acknowledgement. The King County Continuum of Care Board acknowledges that we work on the unceded traditional lands of the Coast Salish peoples, especially the First Peoples of Seattle, the Duwamish people, the original stewards of this land, past and present. We honor with gratitude the land itself and the Duwamish tribe. This acknowledgement becomes meaningful when combined with accountable relationships and informed action, and is the first step in honoring the land that we today sit on and their people.
Thank you, Elizabeth. I appreciate that. If I could hand it over to Amaya for the theory of change.
Thank you, Ruby. Theory of change. If we create a homelessness response system that centers people with lived experience of homelessness, then we will be able to respond to needs and eliminate inequities in order to end homelessness for all. I'll pass it back to you, Ruby.
Thank you, Amaya. Appreciate that. Good to see you. We're going to go into the public comment portion. If there's anyone present from the public that would like to speak, if you're present in the room, please coordinate with Catherine. And if you're on Zoom, go ahead and raise your hand and we will call in the order received. Catherine, did we receive any written submissions?
No, we did not. And there isn't anyone in the room either for public comment.
Great. How about in the Zoom room? Is there any hands raised?
There is not.
Okay, great. Well, as always, you can submit a question or comment to the coc.questions@kcrha.org. And we look forward to hearing from you in the future. This will close the public comment portion. And we shall move into the next item on our agenda, which is what was on our agenda from last meeting we were unable to get to, was the policy on advancing recovery and prohibiting illicit drug enablement. And this is this is a vote actually with Jeff Sims to tell us a little bit more about what we are voting on today. I'm going to hand it over to you, Jeff.
Thanks, Mercy. Thanks, Ruby. Just a moment, please. I'm going to put it up on screen. For the record, Jeff Sims, I'm the Chief Program Officer at KCRHA. And switching. There we go. Okay. Should work. Let's see if it advances. It does. Isn't that something not working, Catherine?
Are you doing the policy on advancing recovery and prohibiting?
Yes, this is also the, sorry, are we out of order on the agenda?
No, you're good.
Okay. As a little bit of back, is okay if Chair Romero, is it okay if I'm also covering 2 slides that provide background, or do you want me to just, apologies, I'm a little confused.
I don't know the actual process of how you wanted to present it. I'm more than happy to receive it how you intended. I think background's always great information to have.
Okay, great. Then we will move forward with that. So again, Jeff Sims, I'm the Chief Program Officer here at KCRHA. First, as you can see on screen, we have a little bit of background and context around the policy that is in front of ideally be in front of the board for a vote shortly. As I believe you all know, on July 2nd, all right, let me fix this. The King County and other plaintiffs filed a suit to block the CoC NOFO. And on August 7th, the court ruled in favor of King County, as well as many other jurisdictions, and the National Alliance Against Homelessness. So the NOFO, the big NOFO, is how we've been talking about it in a lot of our last meetings, has been blocked from proceeding as it's published. HUD did file an appeal with the First Circuit Court of Appeals, and it sounds like action on that would not likely, on that appeal, is not expected until the last couple of days of August at the earliest, but potentially by then. HUD has also indicated that in order for them to meet the deadline of making awards by December 1st, they need some direction before August 31st. So I think that those last couple of days of August, we'll see some things happening at the national level. Although all of that proceeded and meant that the large NOFO that we've currently handled almost every year was halted, that did not impact the youth homelessness NOFO that HUD also released. It had a submission deadline of August 10th. We're expecting to hear back on results of it sometime in September. And similar to the big NOFO, there were bonus points that a continuum could receive if it adopted a policy like the one we are putting in front of you all today. So we noted in our submission and provided a copy of the draft policy that the board would be meeting to talk about this. And then I'll go to, so you can see we did submit the youth homelessness NOFO. Let me see, what other background did I not already say out of order? Noted that the competition won't move forward, that we're tracking, consolidation or appropriations, things like that. So the youth homelessness NOFO is, as I said then, is still has been submitted. We still are asking you to act because we could potentially get from in that youth homelessness NOFO 10 more points on our application if our continuum has in place a policy around prohibiting drug use and I forget the enablement is also in the title. We'll get to that in a moment. That's why we're bringing that to you now, and I'll go over the details of it, the changes that have been made, things like that in a moment. I do want to flag though, and that's the last item on the screen. As I mentioned, HUD is appealing the decision for the big NOFO not to move forward. If something changed, it would be very important that we as a continuum are ready to really quickly dive into sending that application in. This is part of that. It would get us 10 points out of a 220 point score or a 200 point score. That's really substantial. That's that is a meaningful order of magnitude between like a mediocre application and a high scoring application. So that's all the background about why we're talking about this today. Let me go specifically to the policy. So this, if we have adopted this as a continuum for either NOFO, we would receive 10 bonus points. We did, of course, engage with our legal counsel on this to make and are choosing to move forward after connecting with them on the requirements here. And a large part of that, as you can see, is, and what is on screen here is the actual substance, like the thing that the policy actually does. And they're all existing federal laws. And this is actually the language from the NOFO as well. So there's existing federal prohibitions, and we're essentially bringing all of those together and codifying that, yes, we are complying with all of these things. Nevertheless, we also did 2 different sessions with providers and shared it with many of our governmental partners around here as well. So public health, King County, and the city of Seattle, to make sure that we really thoroughly captured any changes, made sure there wouldn't be any operational issues, anything like that. I see Ruby had a hand up, so I'll stop there.
Thanks, Jeff. I had a clarifying question about the background portion. Do you want me to wait until the end? I can wait. I was just curious.
Oh, no, I'm sorry for not catching that earlier. I'll go back. Where were you looking at?
Yeah, I just wanted, if we had any further information on what the actual case was, like what we were asking for them to change in the NOFO, or how did the case come about? What is it actually targeting here?
Yeah, absolutely. That's a great question for context, so thanks for raising that. So the lawsuits, there's actually 2 separate lawsuits filed, but they're kind of moving together in the courts. The one that the state of Washington and other states were the plaintiffs for only went after the $1.3 billion being set aside for new transitional housing and new support services. That does not comply with, in the determination of the court, the current law around how the CoC has to function. That was really for the most part, that was all that lawsuit sought to prevent and was around. The National Alliance to End Homelessness had a similar lawsuit, but it actually covered a lot of other conditions that were also in the NOFO, some of which King County is already protected from, like requirements to comply with executive orders, things like that. And so there was a little bit of a difference there. And then the National Alliance lawsuit was much more expansive. They were kind of just merged by the court, and overall the court just wholesale threw out the entire NOFO and said, HUD, you cannot proceed. Did that answer the question?
Yeah, it did provide more context. Thank you. Yep, we can carry on. Thanks.
Kelsey, I see you raised your hand. Did I get something incorrect in there?
Not incorrect. I just for the board's awareness, the reason the court saw this as inappropriate is that HUD violated what's called the Administrative Appropriations Process or the Administrative Procedure Act, that they did not take the correct steps to make the stated policy changes or process changes in the NOFO. The biggest is that they did not do an appropriate public notice and comment period in order to provide incentives to projects that do not have data and evidence base that they are impactful to addressing homelessness. So that was the biggest issue, is they did not follow the Administrative Procedure Act.
Great, thank you. That was actually what I was I was remembering something about that process there. So thank you for clarifying that, Kelsey. That was what I remembered as well. It's a great reminder to just always make sure that we're doing the best we can when it comes to following our administrative protocols. Thank you.
And,
Elizabeth. Elizabeth.
Ruby,
Elizabeth?
Hello.
Yep, there you go.
Hello, on this policy on advancing recovery and prohibiting illicit drug enablement, is there some incident that brought this up? Have these things been being violated?
Thanks for asking
What's
that.
the context?
Yeah, absolutely. So, and I gave too much, I think that the context got lost a little bit with all the additional details, so I'm sorry for that. Ultimately, the context here is that HUD would give us 10 points on the NOFO if we were to have this policy. That's the context. There was nothing locally that's occurred or any issues or complaints. It is really just setting ourselves up to have the best score as we possibly can.
So this would be helpful locally in eliminating the housing of people who are knowingly selling drugs, right?
I would not put it that way. I would say that there are certain things that are already illegal. So we cannot knowingly operate a place. The primary purpose of it is to sell illicit drugs. That's illegal right now.
Yes.
We cannot knowingly, what's another example? Manufacture.
I think, are we jumping ahead of your presentation? I just want to make sure that we're able to hear the information before we have like a discussion about the information. Sorry.
I think it could be the same thing.
Okay.
I think it'll be okay.
All right, I just didn't want to mess up your flow. Sorry. Thank you, Jeff.
No, you're all good. So Elizabeth, I put it back on screen and you can see the things that are actually prohibited here. And that's what I started to say. So it's already against the law for us to do certain things. And I gave some of those examples. This policy really brings all of those together. And HUD wants to make an emphasis on those, even though they are current law already. And so our analysis as KCRHA was if having them codified in a single spot, even though they already all apply, allows us to do better on the NOFO, then we should do that. That makes sense. And I'll note that
excuse me.
There's counties like Pierce County has already done this. There's counties in California that have already done this. And those are just the ones that I know about. I imagine that most of the continuums in the country have probably did something like this.
So part of my question is, will doing this enable us to enforce these? Or is it just to get the money? Will we actually be enforcing this?
All of these are things that are already requirements and enforced in our contracts.
I think said another way, this policy already implicitly happens across all programs. These are already things that are not allowed in programs that are funded with federal dollars and locally because they are federal laws that exist. The intent of this policy is to have that explicitly written out as a CoC level policy. And the reason is because it was noted in the NOFO that HUD wants to see an explicitly written policy indicating that these things are not allowed. Our CoC did not have an explicitly written policy stating that these federal laws prohibiting these things. So it's really taking federal law, explicitly stating that these federal laws are also relevant to programs that are funded by the CoC.
Yeah, I've got a question. Okay, Jeff called on me. I'll take that. So two questions. This is Michael Pickett. Is it fair to say that this just doesn't really change things?
Yes, it is.
And then you mentioned that you had feedback from stakeholders. How would you characterize that? And was there any disagreement with the policy?
No, but let me share with you, and because I know it was confusing with the board, we gave you the draft twice.
Yeah.
And then there actually 3 times we gave you it. And that was, we did 2 rounds of engagement that was opened to our providers.
Yeah.
And then, as I mentioned, we also specifically asked the county and the city and public health to all also do their legal review.
Yeah.
The public health one especially came back a little bit late.
Yeah.
So let me put on screen, and it shows it as kind of like strike throughs.
Yeah, I saw that.
Okay, I thought I would go through that and.
Okay, so that the feedback was from some other kind of governmental entity about edits, but thematically, there wasn't pushback from providers, people doing service.
Right.
Against this concept.
Correct, yeah.
Okay, got it. I don't need to see the edits. I saw them already.
Oh, okay.
But yeah, I get it. I get it. Okay.
Yeah, thanks, Kevin. This is Devin Koenig-Cease. So I just wanted to ask a clarifying question about specifically on like the implementation of this and the remedies section. What changes would there be in contract administration and funding of these programs as a result of approving this policy, if any?
I'm not anticipating there would be substantial changes there. Let me look again. And the reason for that is our contracts already require, by reference frequently, but sometimes directly, that you comply with federal laws. And if you do not, there's various, it's not like, well, I missed a comma in something, therefore my contract gets revoked. There's always a range of how you respond to things. And that varies according to the nature of what is the issue and the ways that you can be remedied and things like that. So this policy doesn't seek, but the language there, I should put it up for everyone to see. If you give me a moment, is very similar to how we manage our current contracts with that analysis of what is the issue, what is the appropriate way to correct that, what is the right response.
Okay, thank you.
Put it up on screen now for everyone to see. Should pop up. There we go. And make it big enough so yes, we can actually read it. That's great. Let me go down to what you were specifically asking about. Actually, before I go to that specific section, Devin, let me flag for people just what we're looking at. So here's the title. We'll update that it got adopted if it does. Gives you a general background, what we're doing here. One item that we were asked to clarify was that what funds it applies to. It was already stated there, but it was both, we could be more explicit. And then you've got some items that actually, we had listed some things that actually did not fall under US Code 863. So we removed those just to make sure there was no confusion about what was going on. The late breaking addition was because SAMHSA has actually issued with some of its other programs some different guidance. And it was advised that we might cause confusion if we're referring to something that got out of date or whatever. So it's better to not be making those references, but just like, here's how we define it. That's just an improvement. And then let me get down to remedies and appeals. And this is the section you're specifically asking about, Devin. And as you can see that they're like, it could be subject to any range of corrective actions or sanctions. This is very similar to our existing language. For example, our current contracts, it can be terminated for cause or for convenience and things like that. You also always need to provide the opportunity to appeal those determinations, and that's what that second section is. So I hope that thoroughly answered your question, but please let me know if not.
Okay, thank you. Yes.
And I think we have Jack as well has a question. Jack Harlan.
Yeah, hi, Jack Harlan here. So I wanted to clarify, this is about these locations distributing these harm reduction supplies, right, as listed, not about possession by residents or anything like that.
That's correct, yes. So what I put on screen, anticipating your question, 21 USC 856 is often called the crack house statute. And the interpretation of that statute has been, if you have and actually the phrasing of it too, but if you look at it, it is, you will not operate something for the purpose, so the primary purpose of doing things like distributing illicit drugs. That's how that statute is read. So you're exactly right that it is not going after someone who is using, though that is also frequently not permitted, or you have like a range of interventions that would happen to people, but rather we're talking about the primary purpose of having a project.
Yeah, that's really helpful. Thank you. I just quick follow-up too. Would like informational materials, pamphlets, like things that help people to use drugs more safely, could that be interpreted as falling under the prohibited area here?
We've tried to be very clear about what is, and that's why we put in these references. Providers asked us some questions there as well. So you can see, that's why we gave those examples. I think it's a good public health practice to prevent harm. So things like distributing opioid overdose reversal supplies is actually something we, and everybody in the country, I would imagine, does do. We want to save lives and intervene in those moments. So things like that, we wanted to make sure they were clearly not covered, or sorry, let me say that clearer. They are not prohibited by this policy. And then we also sought to be very specific about what is prohibited. What does it mean that you cannot distribute? And so that's why we specifically listed them.
Okay, I see Amy's hand as well. Thank you for your patience, sorry.
It's from what I was reading from the 21-856, there is a caveat that talks about manager control any place as owner, lessee, agent, employee, occupant, or mortgagee. And so I still am concerned that it may have to do with the actual use as well. And so are you working on clarifying, or you just feel confident that that is more about the individual that is supporting the housing, not the individual renting, leasing, occupying the facility? I'm just curious. I'm not trying to be difficult. Just from what I've read, it sounds different than what you just said.
You're looking at 21, the 863.
I think I may have said 863, 856.
I see. That would be the one that, again, that is operating for the principal use of doing those things. And that's actually so the crack house statutes have actually been fairly litigated across the country. And as I noted,
thank you.
Legal review as well, and chose to move forward.
Sorry, I keep forgetting to unmute myself before speaking. I apologize about that. Looks like we still have another hand from Elizabeth, but I just want to make sure that everyone has asked a question that wants to ask a question before we do a second round. Okay, not seeing any others pop up. Go ahead, Elizabeth.
Can you scroll back up just a bit to the part where it talks about using syringes?
Move my window and I'm not not moving for me. Give me a second.
Okay,
Just stop sharing and put it back.
okay. As I recall, there was a line that said, use of syringes for injecting drugs. That would also prohibit the use of using syringes for injecting life-saving drugs or things that are prescribed. It
No,
isn't
definitely not.
specific to illicit drugs, is the way I read it.
Correct. Yes, it is only illicit drugs. And I put
I
this-
understand that that's what the intent is, but it does not say that.
Let me look and see if there's another section you're looking at. So there is.
And have sterile water with the intended purpose of facilitating drug use.
Yes.
You may need sterile water for facilitating drug use that is not illicit.
I see.
That was my concern.
My understanding is that is the literal federal law as it is currently stated and read. So that is actually like existing law right now and understood to be illicit drug use.
Okay, so we can no longer use sterile stuff. All right.
You can, it is not to distribute things that would facilitate the use of illicit drugs.
All right. Hopefully that clears up a little bit on that question. Devin, Conexus?
Thanks. Yeah, this is Devin Koenigsies. Quick question. If this is approved, when would it become effective?
Effective immediately. I don't believe we wrote a effective date at the bottom. Our anticipation was it would take effect immediately.
Okay, thank
you. And it's which it's not imposing new requirements. So they're kind of all already required.
All right, and I see another question from Jack.
Yeah, thank you, Jack Harlan here. Yeah, I think something that threw me a little bit about this document is that the actual directive doesn't come until the very end. You know, there's a lot of definitions and talk about like being compliant with the law and stuff, but the entire thing, as I read it, I assumed would be about tenants, right? Not the distribution of these things, and the distribution being sort of like the main point isn't mentioned until kind of the very end of the document. And I would be concerned that, you know, other people, organizations that we're working with, things like that, would read this document and also misinterpret this as like a broad directive to prohibit the very like existence of these things. So I feel like, for me, intentionally or not, that this is about providing these is the problem and not like banning them altogether. So I don't know. I feel like I'm hearing in other people's questions that there's been a similar kind of interpretation on other people's fronts, and I feel like some more clarity could be helpful.
Yeah,
This is Christina. As a person in recovery, I want to say something. Just because the federal government has it written that way doesn't mean we can't clarify, because there's a lot of vagueness in federal rules that King County has gone through and really clarified to make it so it's better known. Second, to me, this reads high barrier as somebody in recovery and someone who's on the streets right now with a lot of individuals who are struggling with substance use. And not as much as that, but the penalty side of what I read for the agencies. Right now, I couldn't get a person into recovery, and I tried for 13 hours last week to get 2 people in recovery. that wanted to actually get into recovery. I'm afraid of how penalative it sounds the way it's written. And it when especially that line there where it says, so I've got to go to the Braille copy quickly. So if you'll hold on, where it goes into requirements concerning the use, possession, and distribution is in the first sentence. As somebody already mentioned, that's what people are going to read as that first paragraph. Use, possession, and distribution. And a lot of that other stuff at the end is kind of like at the end. So when I read that, I really, as somebody who's on our King County Behavioral Health Committee, we read it over this morning and nobody liked what we heard. Nobody. And it's the way it reads, it's nothing but a punitive document. I don't engage in assertive engagement in appropriate client-centered trauma-informed strategies. That's almost non-existent right now because of lack of infrastructure, lack of recovery support infrastructure, recovery housing. Oh my gosh, that's almost an absolute joke there. With around availability of that. And I'm really, that last part about the remedies, I just see so many, being used incorrectly for people. Say youth care has I'm just using them, has a building, it has this problem, and you know this problem, and then you're going to just pull it, and then I see all these kids out on the street. So you know what I mean? It just seems like I don't like the way it's written myself. It is definitely not written through the trauma-informed lens. It's definitely not written through several of our other guidelines that the CoC has in our charter that things are going to be written through. And I would like to see a better written document brought before us. I don't like, and I will vote no on this. I don't like what I'm seeing. I'm not saying there's not merit, et cetera, et cetera. I just don't like what I'm seeing right now in this document. I feel like it has come pretty quick. And, you know, we like to look at things a month, really that. And we have this pause right now, as Kelsey has said, for the NOFO. It could come quick, but I think this gives us the opportunity to fine tooth this, work on this a little bit better. But I clearly am not liking what I see as somebody who is a King County Behavioral Health member who uses services, who's active in statewide behavioral recovery stuff. This just doesn't go with what we're doing in our recovery community in our state and in our county. So that's my 2 cents from Christina.
Thanks, Christina. I do see Kelsey's hand. I just wanted to quickly encourage the board that, you know, we do have written standards that we're still going to be working on for the CoC, and we can really fine tune some of these things there as well. Kelsey, go ahead.
Thank you, Ruby. And Jeff, please feel free to also jump in here. So this is being brought to the board.
Kind of a background noise calling in.
Sorry.
What was that?
We're just getting a interference with hang on a second, there's something with Teams going on. Did you get that taken care of, Kathy?
Yeah.
Okay. All right, you can go ahead now.
Oh, pardon me. Thank you. Christina, what you said holds a lot of merit, and I think the concerns and the issues that a number of you all on the board have brought up are very spot on. I think the crux of the issue that we are bringing forward to you all is really whether or not our CoC wants to have this policy as it's written, with all of the critiques that you all have noted, is in line with the HUD expectation as they have stated that. So the question is really, do we want to have a policy that meets the expectations that HUD is looking for and potentially receive 10 bonus points in our application, not just the pause NOFO, also the youth NOFO application. Do we want to have that and pursue these 10 bonus points, or is that not worth it to our CoC? That's the crux of the issue. The policy as it's written, from the feedback from providers and from legal review looking at what HUD is asking for, aligns with what HUD is asking for. So substantial change could potentially deviate from what HUD is asking us as a CoC to have. And therefore, we would not necessarily be able to get those bonus points. So in my kind of review of this and looking at what is the expectation and hearing all of you, I think it's really considering as the board, is it worth increasing our CoC score to have this policy, or is having this policy more out of scope of what we want in our community, and therefore going after 10 bonus points is not worth development of this policy?
Add a couple of things to that. At first, Jack, I didn't really get a chance to respond to your question. I hope Kelsey's comments clarified that. It is especially her point that largely, yes, the language here is in many cases, I cut it from the NOFO or from federal statute to make sure that it would qualify to get the full 10 points. And it is the language, the presentation, although nothing new or different. I see why structuring it in a formal policy like that comes across in the way it does. I think it's important as board members sit with Kelsey's question, is this worth it to get 10 points or not? Remember, you could vote no on this. We could not pass this. There is nothing in this policy that wouldn't still be in effect. It's all current federal law.
And yeah, that has been really, really helpful context to provide to the board. Thank you guys for clarifying some of those things. And I just wanted to, I see John has a question, so I'm going to hand it over to him. And I can give my comment afterwards. Go ahead, John.
Hello, everyone. This is John Urquhart. Everybody can hear me?
Yep.
I figured out how to work this thing. So my question is for Jeff. We have multiple provider contracts, I'm assuming, and do all of these contracts prohibit drug use, drug possession, et cetera, on the premises?
They do not explicitly prohibit that. You are required to comply with federal law. Most of the time, we incorporate all of that by reference. And no, you are not permitted, you cannot violate federal law. And then as this policy here does not prohibit a person from using drugs entirely. Instead, what it is saying is you cannot have projects whose principal use is for the safe consumption. Does it prohibit us from being able to, if someone violates, to my knowledge, might not know the full breadth. You can't even get insured if you're like allowing smoking in most facilities. We have to prohibit these things in order for those kinds of things. Now, if you violate a condition of being in a unit, is the automatic thing to kick you out? Often, no. That's not like, and let's take other examples too. There is other ways you interact with individuals that you don't just immediately kick them out of housing. And those are often more effective ways to intervene, not just around drug use, but around many terms of being in housing that we provide support for.
So the main reason we are doing this policy in writing is to keep HUD happy and to get our extra 10 points. Would that be accurate?
Yes.
Okay, thank you.
Yep. Thanks, John, for that. I appreciate that question. Just go ahead. Yeah, go ahead to the question in the room. Sorry, I didn't see it.
Yeah, hi, this is Patrick Arney. I appreciate the discussion today. A couple of things seem true about this. One is nothing changes if we do this. We're already enforcing this. This has language we may not like, but I will say it's somebody in recovery myself and that runs a nonprofit. I often see language I don't like and have to make decisions for the collective. So that is 100% accurate. But I would say the spirit of this is actually to move away from harm reduction. That is clearly what DC is looking for when they are coming out with these contracts and as we do things.
Can you
like this,
repeat what you said? Move away from what?
to move away from harm reduction.
Thank you.
Very clear that that's what they want. And I think that is kind of, we're getting tied up there when in fact, like this will not remove us or move us away from harm reduction based on what we're already doing. But I do have a question. I want to state that, but it does say in here, it says nothing in the above prohibitions shall be constructed to require program participants to maintain sobriety as a condition of receiving assistance. And then it goes on to say, however, to the extent permitted under 22.4 CFR, Part 578 and other applicable laws and regulations, project operators, meaning organizations, may adopt and enforce such requirements at their discretion. That, I think that's the piece, right? The organizations at their discretion can move away from harm reduction if they feel like that's what's best for the population of people we serve. We are not, in fact, making that decision at this table, but we may be giving organizations the ability to make that decision for themselves and the people they serve. That makes total sense to me as a provider. And this, to me, seems like a no-brainer as somebody in recovery that works with people and realizes that it looks a lot different for different people and you need to provide different services.
No brainer in that you support.
Support, 100%, 100%.
Yeah, and to your point, Patrick, 24 CFR Part 578, that's actually the CoC statute. So again, that is actually already in law and allowing that to the degree that the provider wants to opt in that direction.
Perfect. Okay. Thank you.
Yep. Yeah, thank you guys so much for this discussion. It's been a really good conversation today. I just wanted to also kind of highlight what you had actually just covered, the idea that, harm reduction is still, available if through other channels, through other ways, just not essentially through this CoC, right? So unfortunately, I think it just teaches us how to adapt quickly and make it accessible for those who do want to continue with harm reduction if needed. Because I do believe in harm reduction practices and things like that, just personally here. But thank you guys. I think that, absolutely, it sounds like it's a policy that's already been in place nationally. And the language is something that we may not like, but that gives us something to know what we're fighting for in the future conversations. Is there any other discussion on this topic?
Is there a resolution? It's Michael Pickett. Is there a resolution or do we need a motion from a board member?
And you have a motion.
We're going to need a board member to make a motion. Yeah.
Well, I need that back.
Oh.
He has it.
Oh, okay.
I was just showing you if you were gonna make.
So
the
Ruby,
motion.
Jeff is pulling up language for a resolution.
Okay. Or you mean a motion? Yeah. Or whatever it is.
That'd be the language.
However it works, perfect.
So Ruby, if you need somebody to make the motion, you can call on me.
You go right on ahead. That is not my, you're calling on yourself in that case.
I move that the board approves the CoC policy on advancing recovery and prohibiting illicit drug enablement as
Great,
distributed by
thank you.
Catherine later today. Earlier.
Perfect, Michael. Thank you. That's a motion made by Michael
Yeah.
Pickett. Is there a second?
John Urquhart, I second.
Oh, I heard a couple in there. So we got some second and thirds. One is by John Urquhart. The other one is
Patrick.
Patrick.
Barney.
Thank you, Patrick. That's the
Yeah.
third. And great. Then I'll move into a roll call vote with Catherine, please.
Could we do voice vote?
No, we need to do a roll call for a vote.
Okay.
Thank you. Tamara Bauman,
Tamara did
Tamara
note earlier- oh, pardon. Tamara did note earlier she's having audio issues. So Tamara, if you would record what you put in the chat.
Yes.
Amaya, thank you. I heard you. Elizabeth Maupin,
Yes.
For the record, I see Tamara's vote in the chat and it is yes.
thank you, Ruby. Ruby Tuesday Romero,
Yeah, yes.
Christina Sawicki, Victor Liu,
Yes.
Amy Thomas,
Approve.
Rocco DeVito,
Yes.
John Urquhart,
Yes.
Mercy Wainena,
Yes.
Jack Harlan,
No.
Patrick, excuse me, I'm sorry, Michael Pickett,
Yes.
Patrick Arnie.
Yes.
Tina Brown,
Yes.
Nicole Alexander,
Yes.
Devin Koenig Cease.
Abstain.
Christina, can you hear me?
No.
Thank you.
And before we call it, if I could change my vote to no as well, thank you. This is Ruby Romero, to be clear.
Thank you, Ruby. You have 12 yes votes. The motion has passed.
Great. Thank you for doing that vote for us today and that discussion. It was a really good and healthy discussion. We're going to move into the next section on the agenda, but I did want to quickly, before we do that, so we did elect a chair pro temp last meeting, and I am going to enact that role for for Rocco to come on as the main chair for the rest of the meeting. I apologize. I do have a previous conflict of my schedule that I could not change, and so I apologize. But thank you for this vote and thank you for this decision today. Rocco, are you available to take over?
Yes, I am.
Great. Thank you so much, Rocco. I appreciate it, and everyone have a great day.
Hey, Ruby.
Bye, Ruby.
Thank you. Bye.
All right. Well, thank you, everyone. Want to move to the next agenda item?
Jeff, do you want to put the slides back up? Or would you want me to?
I can, I'm almost there.
I have it right in front of me. Oh, you got it. Okay. This is a little bit, we're kind of focusing y'all on the previous information that we put forward on the updates on NOFO and kind of what we're doing. So this may be a little bit of a redundancy, but also just want to hold space for you all to ask any questions or clarifications as it relates to what the status is with the NOFO. Again, the large NOFO, our FY26 CoC1, is currently blocked by the courts. HUD is appealing that. Their response to the court is due today, and the NAH, or the National Alliance, response is due on Monday. There is an intent to have a final decision from the First Circuit Court of Appeals by the 28th. This is based on the timeline that HUD provided the court in their appeal, that they would need to have the NOFO due by August 31st in order to meet the congressional deadline of December 1st to make awards for FY26. We are very closely following all of these things to see what the court decides and kind of be prepared to move with whatever direction that may be. This again has no impact on the youth NOFO. This was a funding opportunity for additional youth homelessness demonstration program funds, as well as a youth homeless system improvement grant that was submitted on August 10th. And based upon that notice of funding opportunity that HUD gave, we should hear back on that youth NOFO sometime in September. When we do, we will let you all know how that turned out. The approval of the policy today should hopefully include some favor in that youth homelessness NOFO application, as the merit review included having such a policy on file. The FY 2026 competition, when it paused, it was blocked on August 7th. All applicants, both those renewing and new applicants, were informed that the NOFO is not moving forward at this moment in time. If and when we have any updates on what it looks like, we will be informing renewing and new applicants. It's unclear what the path, if there is no NOFO reissued, and we get to a point where Congress has to do automatic renewals, whether or not there would be additional new funding, bonus funding available for new projects. So that's very to be determined, and I think a big question mark, but we'll do some careful outreach with all of our new applicants to keep them informed of what happens. For context, we had 49 new applications for the NOFO this year. In prior years, our max was 17. So there was a lot of interest this year from new projects and new applications. So just want to note and acknowledge that, you know, while there are these efforts to push on HUD to maintain projects, an unintended consequence is we haven't seen new projects get funded with CoC funding. So just something for us to kind of consider as a continuum for you all on the board to consider as we think about funding opportunities and how we want to move with CoC funds. As Jeff indicated before, we are still working on the consolidated application. This was published by HUD on August 6th, so was available for CoCs to start the narrative. It includes a lot of new questions, mostly around treatment and recovery services within CoCs. In review of those questions, there are a lot of things that are happening in our continuum that we can speak about. So working to make sure those things are captured. That work will continue whether the NOFO is restarted or not. It's one way that we can just be prepared and have kind of a record of what is happening in our continuum easily at our fingertips, and also be able to kind of have a barometer around what are areas where we want to improve those connections and improve upon what may not be as strong within our community. The other piece that we are doing is reviewing our system performance measures. HUD sent out the what's called a competition report. This is uploaded with the narrative. It's the data that is submitted that includes system performance measures, point in time count information, and the housing inventory count. So doing a review of that in comparison to the matrix review and the scores that HUD would allocate to CoCs based upon that data. Doing a review to look at where are areas in our performance and our performance data and our performance measures where we predict not getting full points, getting partial points, or not getting any of the points. And what are things that we can do to improve those in coming years and in coming months. So one thing that we'll be doing in September is a presentation to you all around CoC performance and highlighting some of the areas where we see a need for some targeted action. And then working with you all to identify what are additional system performance areas that over the next few months you would like further analysis of and further information on. Really so we can just have awareness, preparation, and make good data-informed decisions. Also noting that there are areas that go beyond the homelessness response system to address. There are areas related to the number of people experiencing homelessness within our community, the number of people experiencing first-time homelessness. A lot of this is around inflow. And as a homelessness response system, the inflow of who enters homelessness is outside of just our realm. So wanting to ensure that we are connecting with cross-system partners to put some focus and attention on what's the external environment that is continuing to see increased numbers of households who are entering homelessness or entering homelessness for the first time. And those are things that the CoC alone cannot address. It's impossible in that way. So wanting to put some thoughtful action into those pieces. Those are kind of the efforts that are happening right now. I am going to pause to see if there's also just questions around NOFO, around funding, that we can address at this moment.
It's Patrick Garney here. A quick clarifying question. It sounds like if the stay is granted, all applications are kind of back in business and we're going back to the NOFO selection process. If the stay is denied, HUD will have to either do a full appeal or adhere to whatever laws they are going to change the application process. But what this told us is that HUD has no intention of shying away from a move to more what it's calling accountability-based housing. Okay.
Yep. I would say a big thing that was noted in the order to stay the NOFO from the Ninth Circuit Court was the notice and comment period. I think no matter what the outcome of the appeal is, we will see in the coming months likely a formal notice and comment period from HUD around transitional housing, around support services only, around treatment first efforts, that will likely come popping up as that is very much highlighted as the formal step that needs to happen.
Yeah, thank you.
Elizabeth.
On the external environment pushing people into homelessness, will we be planning in any way to collaborate with advocacy groups who might make a difference on the external environment that's pushing people into homelessness?
I think there has to be all parties of interest who are talking and pushing on those things. You know, we've had great partnership with the Seattle King County Coalition on Homelessness, and continuing to tap into them and their energy as an advocacy partner.
Okay. Will we be working with other groups as well, or just with Sketch?
I would say, this is Jeff Sims, Chief Program Officer. I would say, Elizabeth, that part of what we would hope the conversation when we, over the next meeting or two or three, identify those areas and the board identifies what areas it wants to focus on, that would be our opportunity to identify those systems that we should be collaborating or partnering with or seeking greater engagement from. And a discussion also of what are the best ways to do that and move forward there. So I think the answer is ideally going to be a yes, that we'll be doing more than just sketch. But this is a place where the board really will have its chance to indicate the direction.
Thank you.
Other questions? Or just NOFO related thoughts? We do have the NOFO work group, and that will continue until we kind of know what the outcome looks like. We just want to make sure that, you know, we are continuing to kind of tap into our partners and make sure that we're moving in a direction to really clearly and strongly articulate the good and detailed work that is happening throughout our continuum.
I do have a question about the 49 applicants. Are you seeing more with those applicants, more like more ways of providing services to our homeless neighbors? I saw in the PIT count that the leading people for homelessness, this count was people with less complex social needs and usually single adults. So were you saying some stuff spoken to that population of people? Or is it still pretty much like complex, morbid, high comorbidity issues?
That's a great question. I haven't read through all of the applications because I haven't had the time. I usually do that as I'm getting them in. Our raters are the ones who read those strongly, so I try not to do too much of that before rating happens. It's my way of kind of maintaining my own, like not bringing in my own bias into projects when working with raters and rankers. But from my kind of review of things from a higher level, we were seeing a lot of things that were focused on support services, especially related to employment. That was a really big theme among a number of applications. And that is something that is not strongly funded within our CoC funded projects at this moment in time. So was seeing a lot more projects that were focused on less acute level of need and support, and more around kind of reintegration into our like status quo society. Yeah.
No, that's what I showed the PIT count, and the number one thing like our people need when they come to Wells is jobs. That's what I always hear. So that's not surprising. It follows the data that you guys presented, actually. It's just interesting.
If I could chime in as well, this is Jeff Sims. I think that also we knew for months what was going to be issued by HUD and sought to help agencies prepare to send in a transitional housing application or a supportive services application. Those are things that have not really been supported by HUD for the past more than 10 years. And so we did see a lot of different applications, but some of that goes back to the adage, like, you'll be told what you asked. If we only make it possible for these things, that's what we'll receive. We also, though, we're pretty intentional with our phrasing of our local competition to take what has been years, maybe even more than a decade again, of public input, public comment, collaborative planning processes, like the Breaking the Cycle work group that's happening now even, and added those into, okay, this is what our local priorities have been across a range of populations, exactly to your point. So I felt like what we got was steered by HUD a little bit and also aligned with things that we as a community have recognized we need.
Yeah, the PIT count is one that really stood out to me. Single adults experiencing homelessness have been disproportionately driven by people with less complex service needs, like seeing that on paper and how that's relevant. But it makes sense.
Yeah.
Yeah. More than makes sense. Thank you.
Any other questions or thoughts?
Or Rocco, if you want to entertain a motion, I think in the room I'm seeing something.
Yeah, make a motion, we close.
Okay,
No pressure, Rocco.
we have a motion. Do we have a second?
I'll second.
All right, unless there are any nays, this meeting is adjourned.
Thanks, everybody.
Thanks, everyone.
Take care.